Welcome back to week number 2 for Fireside Chat, where you ask simple questions and we give you simple answers. So let's get started this week. Hey, Lauren, what do you mean when you say data feeds in healthcare? We hear that all the time. People are asking us all the time, do you have a data feed? Do I need a data feed? What is a data feed?
A data feed is the information that's created within a facility's EMR, and that information travels into MediMobile, and we then send it out to the billing system. So these data feeds contain patient demographics as well as documentation, and then, of course, charge information.
So is that ADT and MDM? Is that what those are?
That ADT feed, the admit discharge transfer feed, those are going to be your patient demographics, including your patient's insurance, which we know those billers and coders need that to do their job. Then your MDM feed is your medical decision-making feed. These are the notes that the clinician creates within the EMR. So to have all that in one place is outstanding.
So why would a practice or a group want to have these feeds in place? I mean, they sound really magical and like they do wonders, but why do they really need those?
Rudy, they are magical. We have clinicians that will pull up MediMobile on one side of their screen and the EMR on the other. They'll finish their note or registration will be completed, and they will watch those patients populate in real time. And for your billers and coders, it's a game changer. They're no longer having to toggle between two systems. Everything's right there at their fingertips. And then in a situation where they're using Genesis, they don't need coding. It's done for them.
Oh, wow. That's huge. That is magical.
It is.
So how do providers and provider groups get connected, get those data feeds connected to MediMobile? Are these doctors having to go, plug a cable in and then stretch it across the city and get it over to MediMobile? Or how does this all work?
Rudy, there's no cables.
No cables. All
We're
right.
not dragging cables anywhere. We are connecting with the hospital's EMR. So our dedicated integrations team works with the facilities integration team to set up these feeds. We have various security certifications, so we don't have trouble getting feeds, but we work with those teams at the facilities to set up the feeds to go into our system.
Great. That's great to know. And we have people on staff that are ready to help them be able to get those connections in place.
Absolutely.
So what about from a clinic or practice? There's got to be, I know they exist out there. There's got to be a hospital system that for whatever reason, feeds are not possible. They can't put those feeds. They don't have the technology. Maybe they're just out in rural America somewhere. Do we have a solution for those clinics and those physicians?
Rudy, this is our latest feature. This is exciting. This is another example of where MediMobile revolutionizes charge capture. So in an event that a facility cannot connect with MediMobile due to lack of resources, lack of experience, lack of time, the clinicians or the billing and coding team is able to actually scan, snap a picture, send via file drop, email, fax, the documentation and the face sheets, and we can automatically attach it to the patient within MediMobile. So if a facility is unable to send a data feed, then we have a solution because everybody has their documents, everybody has their face sheets. We can just import it in various ways.
That's great.
It is.
There's a solution.
Yes, and it's fast, efficient. So Rudy, let me ask you.
Okay.
We've added these new ways to take in information, and I know it's one of your favorite features.
It is.
So we can take PDFs, images, various examples of documentation. Why is it such a big deal to be able to send in documents and pictures instead of only using feeds?
It simplifies it. You're carrying it already in your pocket or in your purse. You already have it with you. Now you can take any iOS device or Android device and with a MediMobile subscription, be able to snap a photo right there on the spot, upload it to MediMobile. It gets coded immediately and it's available for you within seconds.
So Rudy, what's the first step for somebody who has no idea where to start?
That first step is you need to get to MediMobile.com. That's right, MediMobile.com. Click the book a demo button there, right? And you'll get connected to our solutions team, right? They can talk to you about the different solutions that we have in place. We can build a timeline. We can get you onboarded in a matter of just a couple weeks, sometimes in a couple days. So reach out to them.
Thank you so much, Rudy.
Great. It's great to have you all. Thank you all for joining us on the second week of Fireside Chat. Come back to us next week. Make sure to click the subscribe and the like button so you can be notified for the next week's episode.